about water. Our group actually studied all waterborne disease outbreaks reported in the United States between the years 1948 and 1994. And we found that a majority, actually about 67% of reported waterborne disease outbreaks were preceded by extremely heavy rainfall months. So we see this issue of extremes of the hydrologic cycle, the water cycle, that climatologists tell us it's not just global warming, it's climate change, it's extremes, more droughts and more flooding, that actually that could present a challenge to our already challenged water quality. And in municipalities with rusting pipes and water systems, this could be an added pressure. So can we adapt to these challenges? As Dr. Frumkin said, we do have we have means to adapt to many of these issues. However, I would argue that we need a multi-pronged approach that includes both preparedness and more upstream greenhouse gas mitigation. We do need to address specific issues of heat waves, air quality, water quality problems, but not lose sight of the root problem that's driving this, and that is climate change caused by greenhouse gas emissions. In approaching climate change, we must also look at this not in isolation of other environmental problems that could act in synergy with climate change. For example, a heat wave over a sprawling urban environment with lots of heat-retaining surfaces, the urban heat island effect, or when a hurricane hits a city like New Orleans and the fact that the coastal wetlands have been degraded makes that area much more vulnerable to a climate event. So we need to look at climate change with other issues. Finally, as Dr. Frumkin mentioned, there are great opportunities, co-benefits, if we reduce fossil fuel burning and change our transportation system and promote exercise. That's a great thing. And in this regard, I feel that energy policy becomes one and the same as public health policy. And currently, there's very little funding to look at these issues of health, especially the CDC and NIH. There's no funding to protect the American public, and that needs to change.
Thank you very much. Sorry, our time is short, but we'll get back with you when we ask our questions. Our next speaker is Dr. George Benjamin. Dr. George Benjamin has been the Executive Director for the American Public Health Association, the nation's oldest and largest organization of public health professionals since 2002. This year, the APHA has dedicated National Public Health Week to climate change impacts on health in America. I'm proud to have worked with APHA and Chairman Markey to introduce a resolution recognizing this week. We currently have 104 co-sponsors on the resolution. As an established administrator and author and orator, Dr. Benjamin started his medical career serving our military at the Madigan Army Medical Center. Later, he moved to Washington, D.C., where he served as Chief of Emergency Medicine at the Walter Reed Army Medical Center. And after leaving the Army, he directed one of the busiest ambulance services in the nation here in the District of Columbia Fire Department. Prior to joining APHA, he was Chief Executive of the State of Maryland's Department of Health and Mental Hygiene, a cabinet-level agency. And we'd like to welcome you, Dr. Benjamin. Thank you, and you have 5 minutes.
Good morning, Madam Chair and members of the committee. Let me first of all thank you very much for that resolution. We think that's a very, very important statement of the engagement of Congress in this issue of climate change. Each year the American Public Health Association creates policies, public policy statements that we think are important for the public's health. And we actually put out our first public policy on climate change back in 1995. This past November, we reaffirmed that policy, and many of the things that are in that policy are very consistent with both your statement, Madam Chair, as well as my colleagues, things my colleagues here at the table have said. Let me just point out 4 things, just in the interest of time. Number one, the fact that climate change is real and does affect our health, and most importantly, that there are certain populations that are more at risk, vulnerable populations. Number two, that we certainly support policies that are co-beneficial, meaning that public health has an opportunity here to get 2-4s and 3-4s and really leverage public health actions to try to improve the climate as well as our own human health. Number 3, that we don't know a lot, or as much as we need to know, about the interrelationship between climate change and our health, and more importantly, what we can do about it. And so there is really a need for an extraordinary research effort to find some of those things out. And then 4, this requires enhancing the public health system with the skills, tools, and capacity to really address this very, very important role. Now, this week, during National Public Health Week, what we're trying to do, of course, is to raise consciousness around this issue. We're asking all Americans to do 5 things. Number 1, be prepared, particularly for these extreme weather events. This is consistent with all the other preparedness activity that's occurring for a variety of threats to human health. Secondly, to think about traveling differently, which means folks like me need to drive less and walk more, bicycle more, do what we can. Thirdly, eat differently. Find ways in which we can certainly eat more locally, do things so that both it improves our health as well as address the issue of climate change. That means eating more fruits and vegetables and less meat, and that's always a challenge for a guy like me. Greening your work, recycling. Even at the American Public Health Association, we had an event, we brought someone in yesterday to talk to our staff about things that we can do to green our work. We actually have a green team at our office, which is trying to lead by example. And green your home, all the things that we talk about in terms of insulating your home, changing the bulbs to the compact fluorescent bulbs, reducing your use of wasteful products, recycling, et cetera, and conserving water. These are things that we think all Americans can do, and we're trying to encourage this week for all Americans to focus on this effort. I think the communication that we're trying to put out is trying to tell the American people that there are things that they can certainly do to address this problem. We also think there are some things certainly that Congress can do. Number 1, continue to play a leading role in this area. We think that Congress and the administration both have an opportunity to play a very important role here. That includes authorizing a program at the Center for Disease Control and Prevention, a very specific program to address this issue, including the funding to support that, funding the National Institutes of Health, particularly NIEHS, to begin doing some of the basic science research that they do, better funding and support for the EPA as well, using some of the vehicles that you already have, such as the to-be debated transportation bill when it comes before you, the Farm Bill, which is in front of you, and others. These are opportunities for you to leverage health into the discussion, and that way build capacity to do some of the things you heard Dr. Pats talk about to make this more of a holistic approach to improving our environment. And also provide funding for health impact assessments so that people are continually asking about what is the health impact of the actions that we're going to do as a way of trying to both do adaptation and mitigation as we go forward. We think in conclusion that we certainly can't wait. This is a very, very important time in our nation's history. We think we ought to start now. I also, with your permission, like to introduce a couple things for the record, both our white paper on climate change, as well as a blueprint document that we have here. If we could possibly introduce those in the record, and with that,
thank you. With that objection, we'll include that in your testimony.
Thank you very much. And Madam Chair, I will pass the rest of my time.
Thank you. Thank you very much, Dr. Benjamin. It's a pleasure working with you. Our next speaker is Dr. Dana Best. She represents the American Academy of Pediatrics. This is a nonprofit professional organization of 60,000 primary care pediatricians, pediatric medical subspecialists, and pediatric surgical specialists dedicated to health, safety, and the well-being of infants, children, adolescents, and young adults. Dr. Best is an assistant professor of pediatrics at the George Washington University School of Medicine and an attending physician at Children's National Medical Center in Washington, D.C. She serves also on the American Academy of Pediatrics Committee on Environmental Health, and in October 2007, the committee published their report, Global Climate Change and Children's Health. Thank you, Dr. Best, for being here, and you can begin your your testimony.
Thank you, Madam Chairwoman. Good morning to all of you. I appreciate this opportunity to testify today on the impact of climate change on child health, and I'm proud to represent the American Academy of Pediatrics in this regard. Human health is affected by the physical environment. As the climate changes, environmental hazards will change and often increase, and children are likely to suffer disproportionately from these changes. Anticipated health threats from climate change include extreme weather events and weather disasters, increases in infectious disease, and air pollution. Within all of these categories, children have increased vulnerability compared to other groups. The health consequences associated with extreme weather events include death, injury, infectious disease, and post-traumatic mental health and behavior problems. Experiences with Hurricanes Katrina and Rita demonstrated the difficulties with tracking children's whereabouts, keeping children and caregivers together, and the special needs of hospitalized infants and children during and after major natural disasters. Vector-borne infections are affected by climate change as well. Both the hosts, for example, rodents, insects, and snails, and the pathogens, such as bacteria, viruses, and parasites, are sensitive to climatic variables such as temperature, humidity, and rainfall. For example, malaria is a climate-sensitive vector-borne illness to which children are particularly vulnerable. Because they have naive immunity, children experience disproportionately high levels of both sickness and death from malaria. Climate change is expanding the range of mosquitoes to higher altitudes and latitudes, and warmer temperatures speed the development of the parasite within the mosquito itself. Small children will be most affected by the expansion of the malarial zones and the success or failure of our response to those changes. Children are especially vulnerable to both short-term illness and long-term damage from air pollution. Children's lungs are developing and growing. They breathe faster than adults, and they spend more time outdoors in vigorous physical activity. Formation of ozone, in particular, is known to increase with increasing temperatures. Children who are active in outdoor sports in communities with high ozone are at increased risk of developing asthma, which has been well documented. Rates of preterm birth, low birth weight, and infant mortality are increased in communities with high levels of particulate air pollution. Some investigators have argued that part of the global increase in childhood asthma can be explained by increased exposure to allergens in the air driven by climate change. Those are allergens like pollen, as previously mentioned. For all organisms, there exists a range of ideal temperatures above and below which sickness and death increase. Humans are no exception. As temperatures increase, the frequency of heat waves increase. Children spend more time outside, often playing sports in the heat of the afternoon, which puts them at increased risk of heat stroke and heat exhaustion. Outdoor time during hot weather may also put children at increased risk of ultraviolet radiation-related skin damage, including skin cancer. Food availability may be affected as land and ocean food productivity patterns shift. Water availability may change and be reduced in some regions. Populations on the coasts may be forced to move because of rises in sea level, and massive migrations are conceivable driven by abrupt climate change, natural disaster, or political instability caused by increased demands for shrinking resources. World population is expected to grow by 50% to 9 billion people by 2050, which would place additional stress on ecosystems and increase demand for energy, fresh water, and food. As these changes evolve, social and political institutions will need to respond with aggressive mitigation and adaptation strategies to preserve and protect public health, particularly for children. In addition to its recommendations to pediatricians for reducing their own energy demands and incorporating sustainable practices into their